everyone. Welcome to our Business Concepts in Public Health workshop. Thank you so much for being here. We're really excited to bring in both people from CASE as well as, which is a group on campus that does some consulting, as well as some people with industry experience from Accenture. So I think we'll go ahead and get started. Cool. So this workshop is brought to you both by ViTAL and CASE, as well as the Husky Health Innovation Challenge, which is our upcoming CASE competition that's going to be this March. And we have thousands of dollars of cash prizes. We're working with a bunch of sponsors, but basically it's an opportunity for undergraduate students to get some hands-on experience working on a really salient problem in public health and digital health, to develop and innovate solutions and then present them to a panel of judges and be in a professional environment and also network with people. So as you can see from the timeline here, we've already had our workshop with Scout. Now we're at our workshop with CASE, and the CASE itself will be released on March 13th. I highly recommend you all go to our website at vitalhhic.org to register. Registration closes on March 10th. Then the CASE will be released on the 13th, and then the competition will be for 2 weeks after that, 1 to 2 weeks. So without further ado, I will hand it off to start discussing the business concepts in healthcare. So this workshop itself will be, if I wanted to pitch a new product in the healthcare space, what business considerations should I make? And so we'll hand it off now to the real experts, which will be Brandon and Paul from CASE, and then Naomi and Rachel from Accenture, who will walk us through business frameworks, what that looks like actually in industry at Accenture, and finally in activities, so we can all kind of put that into practice. So thank you, and off to you, Paul.
Great, thank you. So everyone can hear us okay? Yep, all right, perfect. So yeah, let's get started. We're gonna be just going over just some general, how to go about a case and how to break it down, and then also go into specific frameworks that we think will be really useful for this particular competition. And yeah, we hope you guys enjoy.
Yeah, thank you so much, Paul. So as Paul mentioned, we're going to kind of go through everything from the opening of the case to the closing of the case. And for those of you who don't know, what a case is basically just a way of thinking about a business problem. You'll be asked a question and you're just asked to solve it in a very structured, organized, and a clear manner. So I'm going to take you all through the opening of the case. There's kind of 3 sections to it: the opening, the analysis, and the close. So I'll start off with the opening. And the opening of the case is the first part of the case, when you're first posed with the question. And the overall goal of this is simply define the objective. That's really what you want to do in a case, is define the objective. If the objective is not clear, the whole case will kind of go off the rails. So I'll say it once, I'll say it twice, I'll say it 3 times, however much I'll need to. You have to define the objective and make that clear. That's really the first step. What is the question that you're trying to answer? And that's really what we're looking for in the opening, and what everyone is going to look for. And there's a thing called a framework in terms of case. So what frameworks are, they're basically ways of thinking about the case. There are different types of frameworks that you can use depending on what kind of question that you're posed. So what you want to do with these frameworks is that we'll get a little more into it as the presentation goes, is stay organized. I'll say it once, define the objectives, and number 2, stay organized and clear in your thinking. You want to be able to mentally synthesize what kind of information did the interviewer give me, and what kind of information do I need to answer the audience's question effectively and clearly. So the frameworks are really there to help you really think about a problem, organize it, and attack it in the way that you want to. And that's really where you want to set up the opening. And, to all the visual learners, I'm a visual learner myself. So really, this really helps me kind of see, okay, what is a framework? So a framework is a way of thinking. And as you can see right here, it looks like a little tree. So you start off with the objective. That's your first step. That's what you need to do right off the bat. You step up to the plate. Okay, what are you going to do? I'm going to define the objective. I'm going to define what they're asking me to do. And then as you can see right under the objective, you understand the objective. and there's 3 areas of interests. And that's where the framework comes in. So I'll give an example and we'll get back into this, a little bit later in the presentation. You could say for a profitability case, if you want to know, okay, what is wrong with the revenue of this company? You can break this down into area of interest 1, revenue, area of interest 2, costs. And then you can go a little deeper into each of them. So, and the trick is to here, there's a little trick to stay organized, is you want to go all the way down one branch before you move to the next. So if you see these 3 branches, you don't want to go, okay, I'm going to talk about this area of interest, then this area of interest, then this. I want to go area of interest, talk about all the information I need, go all the way down to the bottom, and then move on to the next one once you kind of get all the information out and, understand where and what am I going for in the case. So that's the open. That's really, again, I'll reiterate it. You want to define the objective. You want to be able to organize your thoughts in a framework, and you want to stay organized. You want to go down one of those branches. Think of the tree in your head. You want to go down one of those branches before you move on to the other one. And the second part of the case is the analysis. The analysis is really the bulk of the case. This is where you are going to really go and do your math. You're going to do your main thinking. You're going to really show what you know. You're going to show yourself off. And this is kind of the part where it's a little tough. I still struggle with it. It's the part where you have to ask the right questions. You have to be able to kind of know and stay organized and realize what you're going for. So again, as I mentioned before, what you want to do in the analysis, that's the part where I mentioned going down those areas of interests to the bottom of that tree. You want to focus on a single area. You want to get all the information. You want to go all the way down, exhaust everything of that branch that you can before you move on. That's how you can really analyze. And you also want to compare. You want to be able to, okay, what's our product like? If I'm pitching this out, how has it been in the past? What are we looking at it right now? And how can it be in the future? And that's something that you really want to think about in the case. It's all about critical thinking. A lot of the thinking that goes on is going to be very qualitative. So you really have to be able to think on your feet, think critically, and be able to go out and kind of show what bring in a lot of the information that you have from school, and even, from little courses like this and workshops. And the overall goal right now is to synthesize all of this information. You want to summarize it into a clear-cut solution. And, you want to be able to refine what you call the hypothesis. Your hypothesis is kind of, you could say, your conclusion of whatever information is given you. So if you're given a case, you're going to have thoughts, okay, maybe it's this, maybe in a profitability, maybe you're talking about the costs need to be cut. Okay, that's my first hypothesis. But then you get information about revenues and you say, maybe we have to increase revenues. So your hypothesis is going to be very fluid. It's going to be moving around a lot. So really keep that in mind, kind of keep your mind open in these kind of scenarios in order to really synthesize the information the best that you can.
Yeah, so that's essentially the main part of how you open and how you structure at least your analysis. So what does that actually mean? It can be kind of vague when you're approaching a new problem and you have kind of this idea of an objective. Like you might be asked to, like in the healthcare, like, does it make sense to open a hospital here? And it might seem quite vague at first, but there's a lot of times you can break those problems and those kind of prompts, I would say, or those cases down into its component parts. And a really good strategy of helping you get to the information you need. So Brandon touched on this. There's some math involved with coming to a conclusion that'll support your final recommendations or your final solution, quote unquote, to the problem. And so an effective tool for doing that is actually something we call market sizing. You can kind of call it estimating. It's super useful in understanding what the potential revenues and, on some ends, the potential costs, but mostly on the potential revenues that are available to your client or to the company at hand. So there's a few main things you want to focus on when you go about market sizing. The first is the who, the users, right? So if, for example, someone says, what's the market of people who buy paint, right? The users there are the people purchasing the paint. It could be businesses, but it could also be people. So you want to focus on those, and you can break those down into even more parts. So breaking down maybe the US population by age or by geography. Um, it could be plenty of other ways that you can break down your demographics, and that'll help you at least put a number on how big your potential market is, which will in turn help you calculate the revenue, because the way you calculate revenue is you take your estimated market size and you'll multiply it by the unit cost. And so when we start to incorporate the number of units maybe one person uses or the costs that each unit costs, that's when you can start to get real value out of this type of technique and this type of estimating. And it really helps you break down, I'd say, very vague or abstract like sums or numbers. So some examples. So here are a couple. The first is, what's the overall, dollar amount of women's clothes that are sold in Poland in a given year? It could either be a dollar amount or it could be just a unit amount. And the second example is a little bit more comical of, how many pepperoni slices, are sold on pizzas every year, or in a month, or in a day, or it could be any time frame that you ask for. Again, those are mostly dependent on who your audience and who's seeking this information, right? So how would you guys go about this problem? I want you guys to take a couple seconds to think. If you guys would like, you guys can type into the chat or unmute yourselves and give ideas. But essentially, remember, you got to think about who are the users, how many are there, right? A good ballpark number is good. Then you can go into, how many units of whatever good or product or service does that end user use, and then the cost of the individual item. So if we break down, in this case, these two potential markets, the solution, or at least one possible solution, would be, for example, taking Poland's population, assuming that half are women, and then multiplying that by the number of estimated clothes that each woman would buy in a year, and then the average price of those clothes, right? So that would be just one way of doing it. Other ways could be taking, the number of people in a town or cities, and then doing the same calculation, but then multiplying the number of cities by the number of cities that you could estimate in a country or a region. So there's plenty of different ways you can break down and to get to that number. And then similarly for the number of pepperoni slices, it would be, how many do you think are on a slice of pizza, and how often do pizzas get ordered? And then if you have a frequency by any unit of measure, so it could either be frequency of families, but it could also be, the frequency of people in, New York or something like that. And then you multiply it by the number of people, or at least number of like households or families or whatever unit you'd like to get to your users. Does that make sense? It's just, a way of breaking down problems to estimate how big your potential market might be. All right. So if that's all clear, I'll move on to the next very, very useful type of framework, which is the profitability framework. And so this is where you can kind of use some of those skills that you learn in market sizing and estimating, because those type of things will come into here if some of these aren't clear enough. So let's take it from a high level and take a step back and see, okay, at the core, what is profitability? Profitability is simply, your revenues minus your costs. And that's pretty vague, and you might say, okay, like, big deal, what does that actually do? And what it allows you to do is break down each of those into their component parts so that you guys can figure out, what is actually your end profit, or maybe they might ask you for a return on investment or any other sort of metric. And this is how you're going to want to go about calculating that. So in the case that I had given earlier of, does a hospital want you, how would you recommend maybe a hospital entering, the Denver area? One consideration would be its profit, or at least maybe its revenues or its costs, right? And so you'd want to highlight those when you're making a pitch or you're trying to propose your recommendation and solution to whatever problem you're presented. So moving into a little bit more of the specifics of the revenues and the costs. On the revenue side, kind of similar to what I had said with the market sizing, is you can use the expected number of units, which if that number isn't available to you, that's where you can do your market sizing and figure out how many units actually are needed or will be sold, or in any given time or whatever time frame you would like. And once you have that estimate, usually it's, as long as it's a fairly precise estimate in same magnitude size, you can move on. And then if you multiply it by either, again, a known price or an unknown price that you might determine through market research and your own capabilities as a company, that's where you'd multiply those two together to come up with your raw gross revenues, right? And once you have that, that's your revenue side. You've considered half of the equation for profit. So now let's move on to the second part, right? The costs. This can be a little bit trickier. I will say that it, can get a little bit more nitty gritty. And at a high level, what we can do is first subdivide costs into fixed and variable costs. So variable costs are different from fixed costs in the sense that variable costs are costs that obviously vary, but usually vary with the number of units that things are used or time. So an example could be, if a phone costs $10 to make, right? The more phones you make, the more costs you're going to have because it's variable, right? So your cost is dependent on the number of units or the utilization of whatever product or service you have. So that's variable. You can consider it, again, kind of like the revenue side in the same calculation. If you have the units and the amount it costs per unit, that'll give you the variable costs. However, there's another type of cost that you have to factor in, which are fixed costs. And these can be a little bit hard to grasp, but essentially think of them as, someone has, like if you're a company and you have rent to pay every month, right? That's not going to change no matter how many t-shirts you sell, right? So that would be considered a fixed cost, but it's still a cost you must consider when you're looking at profit. If for example, that is one of the factors that, whoever your audience or whoever you're presenting to, whatever they want to see, if that's one thing they want you to incorporate, that's something that you need to consider. So that might be a little bit dense, but the one thing I wanted to really highlight and drive home is the ability to segment, right? So when you look at all of these, you could say, okay, yeah, it kind of makes sense that you break things down into its component parts and whatnot, but maybe it happens to be that certain age groups buy your product at different rates, right? So you might have more units sold that, like if you have a different product mix, you might have more like expensive products being sold to, older folks, and then cheaper products being sold to younger. And that might change how, the number of units you sell is impacted. So something that is really important to do is something called segmenting or segmentation. And what that means is essentially just breaking up as much as possible your market or your kind of like, yeah, I guess essentially your market. And what that'll help you to do is, again, have that clarity when you're making those calculations so that your numbers aren't off and that you've considered enough factors for you to make a reliable and accurate business case. Does that make sense, everyone? I know that's quite a little bit of information. Please feel free to ask questions or unmute yourselves. We're happy to take questions as well. If not, I'll move right along. So some examples are, let's take our good old Amelia's, and we all know that, you know, COVID has been rough, but let's say outside of COVID, how do you actually calculate the profitability, right? So let's say you're walking down Huntington and, you know, the owner of Amelia's comes up to you and says, hey, we're losing money, and how do we fix it? So these would be the types of things that you might ask for, right? You might ask to see, okay, how many hours a day do you operate? You know, how many burritos do you sell? How much do you sell them for, and how much do they cost to make, right? And then in addition to that, what how much do you pay your employees and how many do you have, right? So those would be just a basic example of the type of information you might need to calculate maybe a profitability for this particular case, right? Obviously, a lot of other cases are a lot more complex and there's a lot more variables, but something to consider here is when you're calculating, for example, the revenues, this is how you would go about it, right? You'd go and you take your burritos, you'd say, okay, you have in, you know, a given hour you're doing 20, and you can multiply that by the price, you know, how many hours a day you're running, and in a month, and that'll give you the revenue per month. And depending again on the time frame that you're being asked to calculate these things in, that might change. So in this case, let's say per month, this would be the sample calculation. So you'd grab that, you'd put it into your profitability equation, and now you can focus on the cost. So the cost here can be broken into two parts. One is kind of your variable cost that's related to your burritos, and you know, obviously you need to factor that in. So you know, you do a similar calculation as you did with your revenues. You would just substitute the price with the cost it actually costs you to make that burrito. And then in addition to that, something that needs to be considered is the employees and how many hours they work per day and how much they earn per hour. This obviously, in case you haven't noticed, is actually lacking some of the more in-depth analysis. So for example, I had mentioned before fixed costs. So that isn't factored here. So rent would be one of those examples, or any debt that, you know, the company or a restaurant would have to pay, because again, it doesn't change based off of any, you know, volume or any number of hours that it's being worked, right? It's just fixed. So that's kind of how you'd go about this sort of example. I hope that helps break it down into a little bit more, you know, kind of tangible examples of how to do this. So if there's no questions, or if you have any questions, again, feel free to ask.
I have a question.
Yes.
So when you're estimating a cost, and for example, like you're estimating a cost for a product and it's a new thing and there's no published information about it, do you just like try to go to its competitors and try to make an estimate? Yeah, go ahead.
No, I was just gonna say it's a great question. I will be touching on a particular type of framework next that'll help us with, you know, slightly different questions that aren't related necessarily to profitability. Obviously, they can be used for profitability. So I'll get into that in just a second.
Sounds good. Thank you.
Okay. Anyone else with questions about specifically profitability? Okay. So moving to the specific framework that'll help us with those type of cases is what we call the business situation. So what this means is you can kind of have a general business question or a business scenario or a business case in this, you know, in this particular example that you want to solve. And it's not as straightforward necessarily as a profitability in the sense that it could be, you know, what price should we make our product, right? It's not a simple question as just like, oh, profitability, right? So in that case, you would move on to this type of framework where you have other aspects to consider. So you would start again, as kind of Brandon highlighted in the open, you have your framework, right? So you want to draw it all out and what you want to start with is your objective. What's your goal? So, it could be the opening of a clinic, it could be vaccines, it could be, whatever your client ends up asking you or the case is. Or it could even be, again, like, what should be the price of this product? And the next thing you want to do is consider 4 main pillars. I'm not saying that it's limited to these. These are just really good starting points to help get you thinking about what else might be important. So you might want to start with, who are the customers? What is their age? Where do they live? How much do they make? How much are they willing to spend? That type of information will help you understand what's available, and it'll also let you understand how what you have matches what they want, right? So that's where you collect your data on everything about the customers or the potential users of your product. Next, the next thing to consider is your company. So, or whatever organization you're representing or the case you're working on, you want to consider essentially what are the capabilities. So this might not always be super important, but if, for example, there was a mergers and acquisitions case, so like a company is trying to buy another company, this might be something to consider. Do we have even enough money to buy them? Or do our cultures match? That's the type of information that would sit into this like company branch of the framework, because it allows you to dig deep into the capabilities of the company. Next, it's important to focus on the competition. How does your product compare with other things in the market? How does your marketing compare? How do their customers compare to you? Most things, essentially, like your customer, company, and product, can also be analyzed for your competitors, right? So you can have almost like a mini little framework under your competition branch, and that's where you would determine essentially, okay, can we stack up? Where are our flaws? Where are the gaps? And where can we excel? Right? That might help you identify those areas. And lastly is your product. So this is everything to do with how is your product doing? Are you investing in R&D? Has there been good growth? Is there new products coming out? What's the cost to make and to produce? So that'll also help you get an idea of the business side of your case. So if, for example, you get like the potential manufacturing costs of your product, and on the customer side, you understand how much are people willing to pay for this, that might help you actually price your product, right? Because this is my bottom end, right? And we know through our research on the customer that, okay, they're very sensitive to price fluctuations, so we can't go above $100, right? So that'll at least give you a good range to evaluate where should you position in that range. And then with the competition information, that'll really help you hone in on a specific target and a specific value that'll help you maximize, in this case, your profit or whatever value or metric you would like. So those are some initial starting points that we highly recommend people use to approach cases. I know in the healthcare sector, there is obviously a lot more complications due to regulations and whatnot. And so, again, this is just a starting point, but maybe another branch of your framework might be regulations, right? You might want to consider, can we actually make this product? How, will the costs increase? How long will it take to get to market? And that might tie into also your capabilities. For example, companies might not always have the ability to raise, to do clinical trials or whatnot. So this is just a great starting point to use as leverage in moving forward. Did that answer your question? Or not really?
For my question?
Yes.
Yeah, I think so.
Okay, perfect. Well, if anyone else has any other questions about this or what we've covered so far, let me know. Okay, I'll take that as a no. So this is all great. And you might be saying, okay, cool. I get the idea. I have to start here and maybe work my way down. But how do I actually do that, right? How do you find out information when you don't even know what information you're looking for, right? So that's where this next slide with um, a bunch of questions, and don't worry, we'll be sending this out as part of the one pager um, for part of this workshop. So it'll be in there, but essentially it breaks down the different types of um, branches of your framework, and it proposes different questions that you could use to approach it, right? So if you take a look at, for example, the customer segment, you might see questions like who are they, where do they live, or those type of things. And this is just, again, another helpful guide to start and to kind of get your mind ticking about how to solve this problem and how to gather that information that will allow you to get to the solution or your final recommendation. I'd also like to stress that as you're going through these type of frameworks or the cases and working through the problem, it, I can't stress it enough. Keep your data organized, keep your numbers organized, and keep them to the end. It'll be really useful when we go and move on to the close, where you'll need to support your recommendation. So, any questions on this section? Nope. Don't worry again, this will be sent out so you guys can have it as reference. There will be also little bullet points that you guys can use for the frameworks themselves and just as guiding principles.
Yeah, thank you, Paul, for all of that. It's really good information. So as I mentioned before, there are 3 areas of casing. We had the open, as I explained before, the analysis, which I went through, and then Paul took us through the frameworks, and now the close. The close is when you're going to finish it off. What you want to do with the close is kind of knock it out of the park. You want to leave on a good note. And in terms of the close, what you really want to do is use a lot of the information that you synthesized before. And again, I'll state this, and I've said this a lot of times, and I've actually had experience with this in my case interviews, is that most of the time it's not about if you get the answer directly right. It's about if your thought process was organized, if it was clear, and you're able to use evidence to support claims that you make. So I really don't, the best way of approach to this is not really making sure that your answer is right by any means. Of course, it's nice to have the right answer. But what you really want to do is be able to use all of the insights that you gathered from the analysis portion. Say you found that cost was an issue, whether if it was $10 million in cost cutting or $15 million in cost cutting is the solution, that shouldn't matter too much as long as you know, okay, from the information that I synthesized and I analyzed, cost is an issue, and this is what I recommend to change it. So, and again, I'll circle back, synthesize that information, make a recommendation that relates to the objective that you set in the open. I said it 3 times before in the open, you really have to lay down that objective. And again, I said that because not only will that help you guide your case, but that'll really help you provide that really great recommendation. If your recommendation is able to kind of use those insights and it can relate to that objective, you'll be great. And lastly, the presentation of it. This is honestly a pretty important part. It's often overlooked. The presentation of the information has to be good for the audience. Remember that. Your audience is the one listening to you. So you want to put it in terms that people can understand. You want to put it in very simple terms. You could say, I use the acronym KISS, keep it simple, stupid. It's very, very easy to get wrapped up in all the numbers, in all of the business jargon. But, at the end of the day, they're probably, in this kind of, you could say situation, you're going to ask to be presented, or you're going to have to present information that many people may not know in this case. So what you're going to have to do is keep it simple. Make sure that it's clear, it's short, and it relates to the objective. So really that's the close. And if anyone has any questions about really the close or really any other parts of the case overall or casing, feel free to shoot it out. We do have a few minutes, so we'd love to answer any questions. If not, no sweat. But if anyone has any questions. All right, no worries. I guess we can move on to the next part. But it was great presenting to everyone. Hope everyone maybe learned something and can take it forward one day.
Yep. And if you guys need any help or have any questions, feel free to reach out to ViTAL or Case for any help with casing. So I think now it's time to hand it over to our guests at Accenture. So I'll just stop sharing my screen and I'll let you guys take over.
Perfect. Can you all hear me?
Yep.
Perfect. All right. So let me just bring up our presentation here. All right. Can everyone see my screen? Oh, sorry.
Now we can, I think. Yep.
Okay. All right. Can everyone see? Perfect. Okay. Well, thank you for inviting me to this call. So my name is Naomi Lewis. I'm an NU alum, graduated year 08. And I work at Accenture along with my colleague, Rachel Ratchford, who is also on the call. I currently reside in New York City, but I'm originally from Boston. And I've been working at Accenture for the last 8.5 years now. And I'm a senior manager within our talent and organization practice, which pretty much means I work and support our clients with initiatives related to their people and their operations. So that is me, and I'll let Rachel introduce herself as well.
Hi, everyone. Thanks for having me as well. I am joining you from Boston, so I'm actually in Brookline. I have been at Accenture for 5 years and have worked in the same space as Naomi, so talent and organization, but have largely worked with our healthcare clients. So in Accenture, we think of those as payers or providers, and I'll talk a little bit more about that as we go on. But I've largely worked with those sort of clients over my 5 years, and very excited to talk to you guys a bit more about some trends we're seeing in the healthcare space.
Perfect. Okay. So moving on, for those who don't know, Accenture is a global professional services company. So we have over 500,000 people, and that is not an error. There are literally over 500,000 people across the globe working with all types of clients, mostly Fortune 500. And within 40 industries across 120 countries. And we offer strategy and consulting. We offer services across strategy and consulting, interactive technology and operations. And I'll go a little bit more into what those four mean. And that is essentially our company. And the simplest way to put it is we provide services to companies to help them with challenges and problems and issues that they may not be able to solve on their own. And so our purpose is really focused on bridging technology and human ingenuity together. So in our day and age, with the constant change that this world is going through, right, the rapid acceleration and adoption of technology, we recognize the value of that, but also don't dismiss the power of humans. And so bringing those two together, we believe, the sum of these two things together are greater than them separately. And so that is what our purpose is. And in terms of how we deliver on that, so I mentioned these four services before, and we enable and support our clients all the way from strategy, so providing the direction that our clients need, right? Your peers just went through a case study, which is more focused on what we would do from a strategy perspective, all the way to operations. So meaning all the way from implementing that strategy and moving into business as usual, basically, is the best way to put it. And so within strategy and consulting, our focus there is really working with our C-suite clients and helping them to understand how can they be more competitive, what new products can they bring to bear, how could they improve their operations to be more efficient, to reduce costs, how can they improve the customer experience, how can they deliver greater value for not only clients and patients, but also stakeholders. So that's really what strategy and consulting is focused on. Interactive is really focused on how we bring about meaningful experiences. How do we, market ourselves, enabling our clients to better market themselves, really understanding and being human-centered, and understanding what our customers want in order to bring that to life. And so that's what interactive does. Technology is really focused on our cloud operations. So if you're not familiar with what cloud is, as Accenture, we just did a huge play and invested $1 billion in building our cloud capabilities in order to bring those services to our clients. So cloud is when you think about your iPhone, when you think about even Gmail, it is that your services are not on premise, so they're not on your computer physically. They're in cyberspace somewhere, and they're being hosted somewhere, and all that information could be accessed from anywhere, essentially. And that's a real simple way to think about it. Whereas, companies used to have warehouses full of just storage machines, basically, that would store all the information for the employees. Now it is being shared and provided by another provider who is doing it on their behalf. And Amazon does that. That's Amazon Web Services or Google. So you have a bunch of companies, Microsoft, who have shifted their business to provide those types of services. And so we are helping a lot of our clients to move to that. And Rachel will actually talk about, that is one of the case studies that we'll talk about today. But it's all about like your infrastructure and security, right? Obviously, that's critically important these days with particularly cybersecurity, and helping our clients to improve their technical capabilities in order to improve how they operate. And then finally, moving to operations, really it's doing work on the behalf of our clients. So think about if a company, customer service, for example, when you call AT&T, let's say, not saying that this is the case, but an example is that AT&T is like, well, I don't want to handle the customer service line. I don't want to hire people to do that work. Accenture can come in and say, we will run that entire business for you. We will run your procurement business for you. We will do X business for you. So that's what operations represents. So all of that work or services is essentially what we provide to our clients. And then moving on, sorry about that. The other critical thing that we do is leading with innovation. So what does innovation mean? It's really, again, its simplest form is being better, being more efficient, being more effective at doing something. And so we have an entire, what we call our innovation architecture that enables not only ourselves, but our clients to do exactly that. So everything from research to R&D to labs that produce products and things that you can touch, and helping our clients to do that, to studios where you come in and be imaginative, to our delivery centers that help us to scale the work that we do. All of these 6 things that you see on the slide here help us to be more innovative, help our clients to be more innovative, and help us along our 4 service areas. So with that, I'm going to hand it off to Rachel, who will then talk about specifically within, so to simplify it, within strategy. So both Rachel and I sit within strategy and consulting, and within strategy and consulting, you have industries that you support. I largely worked with public services, or public sector. So your state and local government, nonprofits, education, both higher ed and K through 12, and she focuses on health, which again is payer and provider, which she'll talk about. And so what she's going to be talking about is how we do strategy and consulting work in our perspective within the health space. So with that, I'll hand it over to Rachel.
Great. Thanks, Naomi. Okay, so very quickly, I just want to talk to you a little bit about the industry and our fast facts. So globally, we have 20,000 people who work on strategy, consulting, interactive and operations work in the healthcare space. Primarily, when you think about payers and providers, and I know I mentioned we use those terms as our big catch-alls, that looks like, academic medical centers. So think MGH. That looks like the ambulatory center. So, outpatient facilities that may be affiliated with MGH. That is like a health plan. So think of, United Health as a health plan, Aetna, Cigna, those are the types of clients that Accenture supports. In addition to labs, diagnostics, and additional work as well in long-term care. Another thing I would call out is that we serve a vast majority of the healthcare companies that you think about. And I would say it can be anything from the well-established health companies in this space to some of the new entrants as well. So we are really proud of the work we do for our clients, and we really focus on bringing all of those services to market for them. So if we go to the next slide, what I want to talk to you a bit more about is some trends we've noticed in the healthcare landscape. So, it's hard to talk about healthcare trends without COVID, right? Because COVID was such a watershed moment for the healthcare industry. What we found and what we've experienced is that COVID has impacted our payer and provider clients very differently. Providers have fairly slim margins and make a lot of their revenue from the specialty and elective procedures that they are able to provide. So when we think of elective, those are things that are not emergency care. And that is a huge array of procedures. And so, when the lockdowns happened, when COVID happened, and hospital capacity filled up, they really had to stop all of that emergency or elective care. So that really has impacted the bottom line for these providers. Whereas on the payer side, we found that there were decreases in the healthcare utilization and plans. So payers actually have additional capital than their provider counterparts. But to quickly talk about some of the macro and industry trends that we're seeing, just want to touch on a few. I think as we all know, there are massive demographic shifts that are happening. The baby boomer generation, I think it was maybe 2010, 2011, don't quote me on that, but something like 1 million baby boomers were retiring every was the statistic. And or I think it was 100,000. But anyway, a huge number of people are now over 65. And what does that do to the demographics of our country and the sort of healthcare utilization and spend that they have? Another thing that I'd want to call out is around customer expectations. And I think because of how we've evolved and how we're able to use technology and receive personalized services from, all sorts of companies interactions that we have. Think of Netflix, think of Google, where you are able to open an app and get tailored and customized recommendations fit for you. That is something that people also want in healthcare. And so it's been really important for healthcare consumers or clients to think about how they can provide those sort of services to their consumers. I think another thing we're seeing too, and I think 3 and 4 kind of touch on these as well. There's been a huge explosion in the amount of healthcare data we're capturing and how people are using it, right? So I think if you have an iPhone, you probably, you're able to track your steps. Like the health app tracks so much data that we have, in addition to the wearables that we have that now integrate with our phones and everything else. So there's been a huge explosion in this, and there are a number of new entrants into the space who are looking to provide those services. And so, think about a Teladoc, Livongo, Fitbit, companies like that are, entering the healthcare market, doing something really well, and the incumbent healthcare organizations are really trying to figure out how they catch up. Are they going to acquire a company like that? Are they going to partner? Or are they going to try to build up those capabilities in-house? And then finally, I think we all know that healthcare spend and the cost of healthcare is a huge point. And this has been an issue for decades, and I think it will continue to be a challenge in the healthcare space as well. So if we can move to the next slide. Based on the trends that we've been noticing in healthcare, this is how our practice thinks about the work that we're doing in our new future framework. And this is, our thinking that originally was created and was further refined based off the impacts of COVID. So we think of it as future care. So what are the consumer-focused and personalized experiences that we can provide that marry digital and physical settings for our customers? Society, so how can we as an organization move the needle on social determinants of health, improving mental health and wellness in our population? Future work, so how can we make sure that people are able to work from anywhere, even in health, even with the regulatory constraints that healthcare has? And then finally, future foundation. So what are those components that we can enable that will support the core operational foundations of a healthcare organization and allow them to really execute care, society, and work? So some quick statistics about why these are important and at the forefront. And what I would add to, so Accenture and a number of other consulting firms as well develop thought leadership. And if you go to our health website, Accenture Health, you can find some of the articles that I'm referencing the statistics from. But we also have a research team that works and helps us pull some of these numbers. And so that is also what you'll typically see we'll commission studies and things like that. So future care, why is that important? Well, what we have found is that 1 in 4 people who have been dissatisfied with their health system during COVID are very likely to never return to that facility to get care or totally delay what they were going to get at that facility until things improve. We have found that 1 in 10 people pre-pandemic had ever used telemedicine. And there was a 3,000% increase in the number of physicians who would use telehealth services for the first time. So that's something that's going to stay, and that's something that people want. And so ensuring that we can help our clients provide that sort of experience is going to be really important for the future. When we think about society, that's things like social determinants of health. When we think about the COVID pandemic and who it primarily affected more disproportionately, it's how can we make sure that we as a society are helping our clients think through ways they can address health disparities in their populations as well. So future work, I think what's really interesting and important in this space is that what we have found is 60% of US jobs up to can potentially be converted to remote work. And so when we say remote work, we mean models that are outside of the traditional, you're in the office 9 to 5 every day, every week. And we have a number of clients who are actually coming to us right now. I was working on a proposal recently where we were helping academic medical center think through how they can support their workforce and create models that allow people to be at home and still do their jobs effectively and successfully. And then the last thing in terms of future foundation, that really touches on like a lot of the cloud technologies that Naomi mentioned. So a number of our clients are interested in implementing cloud solutions. So I'd say an example of one is the ERPs or enterprise resource planning solutions. And that allows an organization to have an integrated solution where they're able to execute HR, supply chain, and finance functions all in this one cloud-based solution. And in addition to allowing people to work from anywhere, really, if you're able to do that, it also provides them with a unified platform that ultimately helps lower business and IT costs. So those are some of the trends that we are seeing in healthcare and how we as a company are trying to position ourselves to really address our clients' concerns. Okay, so we wanted to share some case studies with you guys. So speaking of the Oracle Cloud implementation, I am currently working on a project where we are implementing this solution for an academic medical center. So they're pretty large. They have over 40 locations in the West, and they have over 4,500 clinicians. They serve more than 1 million people each year. They've previously undertaken efforts to implement cloud-based solutions for some of their functions, specifically HR, and those weren't successful. But they know that they have really aggressive growth priorities. They were able to weather the pandemic fairly well. So they are interested in seeing how they can expand, how they can grow and really continue to maintain their presence as an industry and world-class leading hospital system. So they know that having this integrated ERP solution is one of the many components of executing that strategy successfully. So how are we helping? We have an integrated team across strategy, consulting, and technology that is working on the implementation component of the solution. So really, how do we put the solution into the hospital system and make sure it works effectively. And then we also have teams that are focused on managing the experience that people are going to have along the way. So what sort of change management, what communications are going to be needed, and what readiness will be needed to help people successfully adopt and use this system in the future. So with that, I will turn it back over to Naomi.
Talking on mute here. This is the last slide before we open it up for Q&A. But what I will talk about is Medicaid transformation. So if you're unfamiliar, the government provides free healthcare. So federally and at the state level or through states, the government provides free healthcare. And that is called Medicaid. And it depends on your income if you qualify for it. But if I'm not mistaken, typically at the state level, besides education, healthcare, and paying for Medicaid is a second largest expense for states. And so for a particular state that we were working with, they are a $14 billion Medicaid program, and they serve over 2 million residents every year. And they were looking to change the way that they service their customers. So think about the fact that their old model was that if I'm on Medicaid and I qualify for it, I would go to a doctor's office, I would, have an appointment, complete that appointment, and then the doctor would bill the government. And so the government would then have this huge operation that works to facilitate that whole process and make sure it happens. So the government was largely responsible to do that work. They wanted to move to what is called a managed care model, which means that they are overseeing another entity that's doing the work. So almost like outsourcing it, but not fully. They are saying, hey, like Rachel mentioned before, not providers, oh my goodness, payers, excuse me, your Aetnas and your Cignas and your Blue Crosses and your Uniteds, whomever, whatever company was selected, do this on our behalf because you're more efficient at doing it. You have the resources to do it better, and we'll pay you money to do it, but we will oversee you doing it. And so that is completely shifting the way that they operate overall. And so we as Accenture came in, and the goal of that, right, the intention of that is to bring about innovation in how they service their customers and their beneficiaries, provide a better system of care, and also help to reduce costs. So what we did is we helped them from end to end. So we help them with the initial part of developing the strategy, looking at the new processes that they're going to need in order to do the work. and change the way that they operate, looking at their technologies and their systems and seeing what new things need to come into play, helping them with putting out the contracts that they would use to then select the payers that would do the work on their behalf. The 450 people that were part of their organization, my responsibility, and actually Rachel was on my team, to figure out, okay, what is their new job? What new skills are they going to need in this new model? And then also overall preparing the whole state for this whole change. And so that is the type of work those are two examples of the type of work that we can do within the healthcare space. And you can see where this sort of merges with public health. Some other things that are happening in the public health care space when you think about COVID is vaccine management. We have offered a solution to our states to help them in the whole supply chain process, from getting the vaccines, how do they distribute it, that entire process. We are also helping them out with that too. So with that, I will pause and then we will open it up for Q&A.
Hi, Naomi and Rachel.
Sorry, you can go.
Oh.
I'll go after.
Oh, actually, okay, cool. Thank you guys for your presentation. So I was wondering, you mentioned how COVID affect the healthcare system. So I know for a lot of, probably for a lot of your clients, as we shift into virtual or remote care, their policies might be changing regarding coverages or patient benefits. So I was wondering if you guys have worked with some of these clients, offer them advices regarding this drastic shift, because I just find really fascinating how fast they need to come up with these new policies. So I would just like to hear if you guys have worked with it, or how's the experience like? What were these payers' concerns? Yeah.
Yeah, so from, and I'll let Naomi speak about the public service side a bit, but from a payer perspective, I'd say by and large, as part of the benefit design, telehealth is a covered service. It's not something that people availed themselves of in the same way, but it was something that was part of a benefit plan if you looked at your summary of benefits and coverage that you receive. So there is the infrastructure already to reimburse very quickly on the payer side. On the provider side, it's a little rockier, right? I mean, there are some companies that are out there already, and again, think of a teledoc that contracts with physicians to provide telehealth services. But hospital systems did absolutely have to expand what they were doing as well. I would also say, additionally, we experienced and noted that I'd say one of the things that health organizations are thinking about just generally, and I'd say from a payer lens, is, we focus on insurance and providing insurance, right? And so how do we pivot to maybe being a healthcare company? And retailers are also thinking about that too. So, and that's where you kind of get into, is this something we want to build in-house? Do we want to maybe spin off a digital arm that is going to be able to build this sort of capability for us? Are we going to enter into a partnership? So a number of payers actually do partner with Teladoc and Livongo. Or are we going to try to acquire something? So those are the sorts of questions I have found that payers are thinking about. And I'd say from the provider lens, they're just more so looking to expand the capabilities they have.
Yeah, and to add to that from a public health perspective, or from a government perspective, I haven't personally worked on that type of project that you mentioned, in terms of changing policies and that sort of thing related to COVID. However, the process that is similar is, particularly on the government side, the federal government has to provide the direction, right? So the states are getting the money from the feds, and the Center for Medicaid and Medicare Services, CMS, they are the end all be all around public health care. And so what would happen is that if it was not already a rule or a policy that was already established, that direction would need to be provided, and then the states would have to consume it and then apply it within their processes. I'll give you an example. I was on a project when the Affordable Care Act, aka Obamacare, came out, right? And basically the Fed said, we will pay 90% of your bill in order for you to upgrade your systems to make it easier for people to access not only healthcare, but also food stamps and a bunch of other human services that the government provides. And so we had to basically wait for that, literally that law to come down. I was on the team that had to look at that policy and disseminate it and basically make it layman's terms in order to share it back with our clients to say, okay, this is the new way that we're going to operate. And when it's an emergency like COVID, it's going to happen fast, right? Like the biggest issue, and it's very surprising, right? Particularly in the public sector, what do you mean work from home? Our people can't work from home, right? Like that's impossible. But look at when something like this happens where it forces you to do so, it is very, very, you can get it through. And so, yes, you have legislators that have to contribute to it and everything, but when you push the pedal to the metal, you can get it done. So that's just another perspective, but more from the public side.
And what I would just add in closing, along the lines of CMS and policies, a rules change that came down did expand reimbursement for telehealth services. And I think that is very likely going to remain. I mean, it's worked for people. It, in some cases, is lower cost to plans and to the government. So I would be surprised if there's something that's done that reverses that guidance that came out.
That's fascinating. Thank you so much.
Yeah, so I had a question, I guess, more on like the organizational standpoint. Clearly, like a lot of these projects, especially during COVID, are like being fast tracked for the client. And I saw within the case studies that like you guys have a bunch of different like teams, like strategy, operations, that are working on these projects. So my question is what the dynamic is like within Accenture when you are working across teams, and like how does that work, I guess, is my question.
So that's actually a really great question. So I'll say it this way. So the way that, when Rachel and I were on that same project, it was the first time that I met her. And we were actually in two different areas, like technically two different areas of the company. Like she was aligned to health and I was aligned to public sector. We came together because of the project, right? And the skills that it needed. So when you think about it, the work obviously drives the demand, right? So the work drives who and the skills that Accenture needs and the people that we need. And so think about it that literally that if I'm a senior manager and my job is to basically say back to the client, this is the way that I'm going to build my team. And I would basically like pluck people from different parts because I know I need these types of skills. So it's actually, you run into different types of people, right? Those who are focused on technology, or those who are focused on like digital, or those who are focused on, analytics, or whatever the case is. And what happens is that you really build a dynamic team. So you're not only getting insight into other things that people are doing at Accenture, but you're building friendships, right? Like Rachel and I, if it wasn't for COVID and I was up in Boston, I'd be like, hey, let's grab drinks. Like last time I was in DC, I did exactly that, right? And so obviously you don't get along with everyone, but it definitely helps you to grow your understanding of what we do, but then builds new relationships, build new partnerships. And it's fun to me, in my opinion. But Rachel, I'll let you add on to that.
Yeah, I would say it's a lot like a group project on steroids, if you will. Yeah. So, when you think about the dynamics of that, it is like we've all been on group projects that have been fantastic, and we've all been on group projects that have, we'd like to forget. And so I would say it's a lot of that. But like what Naomi mentioned, our CEO, Julie Sweet, really likes to use the phrase, we are one Accenture. And So she wants us to go to our clients, not necessarily thinking that, oh, she's from strategy and she's from consulting and he's from technology. We're just Accenture. And people have the skills that are required to be there, but ultimately everybody has insights and perspectives that are valued. And that's something we really try to live out every day. So that's what I would say.
That's really great to hear. And also that does make sense because like clearly the more diverse your group is, like the more like perspective you bring and like power you bring to like the client. So that's great to hear. Thank you for answering my question.
Yeah, of course.
And that's spot on. You're exactly right. Any other questions?
All right. Well, I was gonna say if people are ready to transition also to the next part, we can also hop back to the activity, unless people have more questions.
I guess I have one more question. Sorry.
No, go for it.
This might be like maybe you can't answer it. I don't know, but I guess have you guys done any work in like with like rare diseases and like in that space? And have you noticed any like trends within that space? Because I know that there is a lot of like policies around that, like the Orphan Act and stuff like that. So I don't know. Just have you guys worked in that space?
I've not personally, but we do have a pretty large life sciences practice, and one of the components of that is pharma. And I know that I know someone who actually is working on a market access project, I think related to a specialty or orphan drug. So I do know that we do some work in that space. I just have never worked on it.
Yeah, me neither. But the one thing I could add that's kind of, it's like on the periphery, is I know of a project. I was not on this, but I know of a project based out of Ohio, where Ohio at the time had a very high infant mortality rate. And it was very prevalent among Black women, unfortunately. And so the state was like, what the heck do we do? And so they brought in Accenture really around data analytics. So it was like grabbing data from like 3 or 4 different agencies to help build a dashboard, do analytics and build a dashboard to pinpoint why is this happening? And then figure out like recommendations on what they can do to, move forward to help bring that number down. So that's just one that I thought of that is kind of close to your question.
Cool. Yeah, I know it's kind of an out there question, but thanks.
Yeah. Questions?
Hi, I have a question. Thank you so much for both of you being here. I was just wondering if either of you had any advice about what you might say to someone who's kind of starting out in their career and how to really get into consulting or strategy.
So real quick, my transition into consulting was not the traditional path. So I actually remember learning about consulting my last semester at Northeastern. I took the course and I was like, oh my God, this is amazing. Like, you get paid to solve problems. Like, you get paid to give advice. Like, that's great. But usually the way it works for a lot of the top consulting firms is that they have a very formal process. First, they have targeted schools that they usually recruit from. And that usually starts like the fall prior or even like your junior year, where they're looking for interns and all of that. So I basically missed that window because I wasn't aware. But essentially I worked for a software company coming out of school. And then at some point I must have applied to Accenture. And then I remember getting an email one day like, hey, your resume matched to a position that's open, and then I got into Accenture. So beyond that, so that was my journey. And that is a way to enter Accenture, what they call an experienced hire. You're not coming in through the analyst, like analyst, consulting manager, like that typical approach, what they call a lifer at Accenture. But so that's just one way. But the other way is thinking about that now. So now that you guys know that you want to do this, making sure that if they're on campus recruiting, that you are there. We're actually working at Northeastern, like Accenture, Northeastern is one of our clients. And so being very aware of what are the consulting companies on campus and when are they recruiting, looking on their websites or talking to career services to figure that out. I think more and more companies are starting to move away from like the targeted schools, not fully, but providing some open positions for non-target schools. And so looking at their websites and doing your research to, if you really want to do it, to get there. And then practicing your case studies, being very knowledgeable about how to approach a problem, that is very critical. We still use that today. To this day, like what you just learned are things that we still do today. So that would be another thing. Network, get to know people. And yeah, that would be my advice in terms of getting into consulting.
Yeah, and so just another hat that I wear at Accenture is I am the day-to-day program lead for our analyst program, specifically our consulting analysts. So basically, I work with our executive sponsor on initiatives once people get here and in the analyst program. And really, like what I've heard when I've talked to recruiters is that they look for bright people who are really eager and interested in learning and have done well in school. So those are the sort of things that I've been told our recruiters tend to look for. I think you absolutely will have to nail your cases when you go through the process, but really, like, we hire people with an array of backgrounds. Like, I was a biology major. So, I didn't have a traditional business background, but had experiences in healthcare that people thought were interesting. And, so you don't have to be you can enter consulting through varied, degrees or experiences that you might have or might be getting. But I think what they tend to look for are people who really do well on the cases, who've done well in school, and really demonstrate like an eagerness and willing to learn and solve problems.
Great. Thank you so much for sharing.
For sure.
All right. Well, thank you so much. Those were some really good questions as well. So now we wanted to do an activity. So we highly encourage everyone to unmute themselves and participate. It's essentially just going to be going through, let me share my screen actually. All right, can you guys see my screen? All right, perfect. So it's essentially doing, a case study together and kind of trying to see, how would you approach these kind of cases, and what would you think about? So let's say the case is, how would you determine if a company like J&J should partner with other pharmaceutical companies? Some of you may have read recently in the papers, Johnson & Johnson and Merck will be partnering for some of their vaccines and to help them distribute. So this was kind of like the idea, but the question here is, how do you think a decision like that would have been made, and how would it have been presented to, the executives? So that's kind of what would, like, the main question of that we're trying to see. And so if you guys want, feel free to kind of shout out ideas. Where would you start? And what are the things that you would consider or would want to know more about? Like, what information would you want to get before making a final decision or final recommendation? So, you guys have...
I think I would first want to know, what was driving a partnership. Is it something that they're lacking, or they don't have the infrastructure to, say, distribute the vaccine or to create the vaccine? It's, is it something they need, or is it something that they're hoping to get?
Okay. So, like, what's the motive? Okay. Anything else?
I think I would be interested in learning what would Merck or other pharmaceutical companies offer.
Okay, so like the products?
Or
Okay.
resources or anything based on the motive.
Okay. Anything else? Any ideas of maybe, how would, the CEO of Johnson & Johnson decide, yes, we're gonna, give another company our vaccines? Like what would drive that as well?
I guess would be like, what are the benefits of a partnership, and like, I guess, what are the costs?
Okay, so you said costs of partnership and benefits. Okay. Could you give me examples of like what type of information you would want to like see about the pros and the cons, kind of?
I guess it would be like, I guess in terms of the vaccine, like how much could you increase your vaccine production and streamline distribution by partnering with another pharmaceutical company compared to just developing the tools in-house?
Okay. Good idea. Any other factors you would want to take a look at?
Maybe if this company has something that Johnson & Johnson doesn't have.
Okay. Great. Running out of space. You guys are getting good ideas. So the competition and what they have to offer. Okay. Any other ones? Anything else? That's okay. So from just looking at what you guys have proposed, I think some of you might notice that some of them might fall into categories that we had talked about earlier in like the framework section of today's workshop. So the first might be the capabilities, and what are essentially the driving factors behind this choice. You might move on then to the competition, right? That's another branch that you might consider and look at. You would also look at essentially, let me put the products, sorry, getting a little clustered, but you'd look at the products that you're currently offering, and maybe the capabilities that your current company has. And then, under competition and capabilities, this might fall under both, are, your cost of partnerships and kind of seeing the pros and cons of developing it in-house. That makes sense? Like you could start to even just take these kind of rough ideas of, how do I structure this, and start to lay it out into more clearly defined, verticals or branches that might help structure how you then go looking for information. You might start, maybe you say, okay, actually, I really want to understand what the motive is because that'll help me further down the line. So you might start with that, right? Another thing I might add is, if, for example, the motive they tell you is we want to see a return on investment of 20%, right? That gives you your motive, but what does that also tell you? Is it also tells you they want to be profitable, right? So you're going to need to, calculate the costs, you're going to need to calculate the profits, and, you're going to have to kind of go through that profitability framework, but like a miniature version within that kind of branch of your framework of what's the motive. Another thing that might be interesting is regulatory considerations, and seeing, what's the incentive, maybe what's the policy behind, pushing to them to work together. In this particular case, again, going off of that one article, the National Defense Production Act, or I always mess up the acronym, but it can compel people to or companies to have to work together, and so that might be also another consideration of motive. That might be that might change your outlook of should they or should they not. Any other ideas of how you might, factors you might consider, or how you might present this type of information to, an exec or to your audience or a board? Any ideas? Okay, it's okay. So, it could be that, you found the solution, you've gone through each of these branches, all these great ideas, and you find out, okay, this is my final recommendation, they should or they shouldn't. And then you lay out, these are my reasons why. So that's always an effective way. I think Bren touched on it when we were presenting. It's an effective way of convincing someone of your decision, because at the end of the day, they're the ones taking the decision, and you're the one providing. So like you're providing the solution. So they want to have a good understanding of why should they do that, and what are the potential risks also for them. But I think these are all great places to start. I know we're almost up on time, so I just want to leave, if anyone has any other questions, either for myself or our amazing guest speakers, or I don't know if they're still on. They're not still on. Never mind. So yeah, either questions for myself or for ViTAL. Otherwise, thank you. I think these are still up.
Thank you everyone for coming tonight. I hope that you learned a lot about casing, and thank you Paul and Brandon for helping guide us through that, as well as Rachel and Naomi for giving us a lot of insight on Accenture. Definitely don't hesitate to register for our case competition, where you can kind of apply this in the healthcare space and then get money for it. We increased our cash prizes. So first place is $1,500, second place is $1,000, third place is $500. And it's just open to teens in Boston. So your odds are pretty good if you get into the finalists that you can win cash prizes, as well as just attend our events and continue networking with sponsors and all that fun stuff. So you can visit our site at vitalhhic.org to learn more. Thank you.
Thank you, everyone.
Thank you so much.
I had a quick question, actually. Where do
Yeah.
we find the recordings for these? Because I've missed a couple, and I know some of my teammates in the challenge have class right now, so.
Yeah, absolutely. So we have been sending the link out if you're on our mailing list, but you can also find them if you search ViTAL Northeastern on YouTube, where we post all of our workshops and other speaker events.
Awesome, thank you.